Hello, my name is Anthony Lee. I'm a consultant cardiologist and heart rhythm specialist, also known as a cardiac electrophysiologist. I work at St George's and Queen Mary's in Roehampton, as well as St Anthony's Hospital and London Bridge Hospital. So I decided to pursue cardiology as a career because it's always fascinated me. I think it's the perfect blend really between medicine, surgery and technology. It's always been quite a fast-paced specialty where we're able to bring, the latest treatments to our patients. I also undertook a separate period of specialist training to deal with heart rhythm problems. I've always been fascinated by the ECG or heart tracing that provides a small window into the functioning of the heart. This has meant that it's taken me across the pond to the US, where I did some additional training at the Cardiac Arrhythmia Center in Los Angeles, where I've become an expert as well in all heart rhythm problems, but specifically to deal with ventricular ectopic beats and ventricular tachycardia, which is a specific rhythm from the bottom chamber of the heart. I really enjoy this specialty because it really puts me in touch with patients of all walks of life, from the very young patients who are highly sporty, elite athletes, all the way up to patients in their 80s and 90s who may have slower heart rhythm problems. And I really enjoy the whole breadth that this specialty offers me. So I grew up in South London. Both my parents are nurses. And so my parents are very much in the medical specialty. I went to university at St George's and trained in South London and in the south of England, and also did part of my training in the US. So the thing that I find most rewarding about my job is really getting to know my patients, getting to really understand what their concerns are, what their problems are, and finally seeing the really positive impact that I have had on their condition and their quality of life. And it's really nice to see patients after they've been treated improve, and it's really a privilege to be able to be in a position to do that. So I think that my patients value most about me is that I really spend a lot of time with my patients, not only explaining the treatments, but also explaining their condition in quite a lot of detail, in really understandable and relatable terms, which it really empowers them to kind of take control of their condition and really understand what they're feeling and what the outlook is. And they really appreciate me taking the time to do that. I've written some articles for the British Heart Foundation for their patient magazine, and I always have patients commenting to me that they really enjoyed the article that I wrote. When's my next one? So I think they really appreciate the way that I explain things to them.